What looks like a beautiful environment of rolling hills and lakes, really to Rwandans is a hard to access topography where healthcare is scarce.
This is a district of over 400,000 souls, and in 2003, 2004, there was not a single doctor, much less a district hospital.
Paul Farmer is the founder of Partners in Health, a visionary nonprofit organization that's really changed the landscape of healthcare. I was in my first semester of my first year of graduate school, and when I went and saw him speak, he was talking about healthcare, but he was talking really about buildings, building hospitals, building clinics, building schools. I really wanted to understand how I could get involved and who the architects he was working with. Of course, he said, architects, why would I ever use an architect? I just draw the hospitals myself. Sometime in November, I got a call from Paul's assistant. They said, look, we need to build this new hospital. Would you be interested in helping? I said, well, I have no idea how to build a hospital, but we can figure it out.
We were not naive to the fact that we were students. We'd never built a hospital before. But what we found was the way things were being done without architects was so problematic that we thought we could bring something to the table to help.
Suddenly we had a hospital to design, and 8 months later I was living in Rwanda full time. This kind of deep immersion I realized was something that was missing from the architectural profession.
This is saying, let's take our mindset as a designer and work with partners and really be the kind of translator of a bunch of different expertises. And this is the way we can use architecture to help be a part of the solution. Someone showed us where an outbreak of tuberculosis had occurred. All these people had come to a clinic and gotten sick there. We said, well, why is that? And they said, well, it's because they're in these crowded hallways where there's no ventilation. And we said, well, so why have hallways?
If the building is designed in such a way to increase airflow and reduce infection, it's actually performing to improve health.
Step number one, let's design a hospital with no hallways. Step number two, we created these rooms that are a single loaded building so that you have cross ventilation. Initially, we had to excavate the hillside. And so we said, well, what if we do this with the community? And instead of one bulldozer, we have 1,000 people.
If you change the way that we build to have impact along the way, then the building isn't just a performance of improving health, it's the building process which can also improve a community's health. We had an idea of what we thought a volcanic rock wall could look like.
So we took previously unskilled people and kind of worked together to figure out what are the best ways to communicate with one another to get the right end result.
By the time they got to the end, you can actually see the difference in the quality of the craft. Some of the workers actually asked us if they could go back and correct the work that they had done in the beginning, which we refused because we thought it was pretty good to begin with.
Since it's opened, patients are flocking in from even Uganda. The most drastic drop in infant mortality in one region that they've seen anywhere in the world. This is the model of Jirubuntu School. Primarily what we wanted to show in this model was how it's touching the landscape, and in particular, how we're thinking about dividing up the kind of unique hillsides of Rwanda.
As we were driving around the kind of Rwandan countryside, which is very mountainous, you could see the way people walk up and down the hills on switchbacks. We thought we'd take advantage of that typology to kind of create these unique terrace play spaces, very Rwandan in many ways, but hadn't really been deployed in this way.
This was kind of an emerging neighborhood in Kigali, and in the 3 years that we've been working on it, there's been an incredible amount of development around the site itself, and you can see new middle-class homes going up. I feel like it's been part of this change in the capital itself, and it'll fit nicely and weave well into this community.
As we said, design isn't neutral. It's either helping or hurting, and where do you want to be on that kind of spectrum of things?
We have a responsibility to the public, and we can use it as a lever to add value and insist upon quality and make sure that the poor, for example, or the marginalized, our public, gets the best that we can provide as designers.